The CARE initiative, which stands for Compassion, Appreciation, Resiliency, and Empowerment, was launched in 2016 by Snohomish County's Human Services Behavioral Health Department, the Children's Wellness Coalition, and Child Strive. The goal is to foster and build trauma-informed, equitable, and restorative workplaces. This model supports staff and service recipients through intentional relationships, healing practices, and sustainable policies. This initiative shifts focus from what's wrong to what has happened, enhancing empathy and support while holding high expectations. Over 50 organizations in Snohomish County, Washington, have adopted this model, demonstrating its effectiveness in promoting workplace healing and resilience.
The work that the CARE program does is hugely beneficial no matter what kind of organization you are, whether you're a nonprofit, whether you are a for-profit, a corporation, a governmental entity. Its work is invaluable.
There's really been this open-endedness of exploring what do these concepts mean and how do we bring these like technical skills in alongside these softer skills around like empathy, resiliency, and how do we move forward as an industry, especially coming out of COVID.
We're training our law enforcement officers to really look at trauma as an underlying issue that all people deal with. And so every person that we interact with comes to us with their own set of traumatic experiences, and it gives us a different lens to look at people through and to see them as a whole person rather than just an incident-based individual.
There's been a lot more focus on being trauma-informed at work, and I think there's been a lot more focus on what that means in terms of self-care, in terms of how we care for each other in the workplace, how we care for those people we serve, and how we care for our contractors. So I think we've changed in all of those areas, become more conscious. I think it's always been a value, but now it's explicit.
It's about being in a place where you feel supported, where you feel heard, where you have a degree of trust in your leadership and what you are a part of. And I don't know how any organization could not embrace that concept, because when you have those things, when you have a workforce that really understands what they do, how they do it, why they're there, and why it's connected, you have a stronger organization.
I'm seeing a community that is being restored. We've been through so many challenges, and we've just been through the largest pandemic in a century. We need to recognize we've been traumatized, and we need to recognize that we need to restore from that. And so the application of CARE's restorative practices is really critical, and recognize that communities have been impacted disproportionately. And so looking at how do we assure equity in our response? And equity does not mean everybody gets the same response, but they get a response that helps them on their personal journey.
The principles of the CARE movement in Snohomish County are excellent at bringing people together by function, by group, and just in general to really ensure that you feel comfortable, even when things aren't going well. And has anybody had a problem with this? Or what are some successes that we've seen? And we share information, and we cultivate that spirit of curiosity and learning that is so critical in this work.
Since the CARE movement has started in Snohomish County, what I've really seen is a little bit more coming together and a little bit more focus on how can we be a healthier community together.
It's been very exciting to see the work, the co-work, and the co-support between all the agencies that have been a part of the CARE work, whether they've been doing it for a while or just starting.
It is making a difference for the care that we provide for our patients. It's making a difference for the staff who are working in environments that are using the trauma-informed care guiding principles.
As a community, we're talking more about resiliency. We're looking at what are the resources and the assets we have in the community already that can be the foundation. So we're not creating something new from a whole cloth. We're adding to what already exists, but we're honoring what already exists as well.
I think resiliency is knowing that It's not always going to be a perfect interaction. You're not always going to say the right thing. But knowing that you can always bounce back from that, whether you're a client, whether you're someone that's trying to figure it out like myself, it's not always going to be best case scenario, but you will always have an opportunity to bounce back.
These are concepts that are meant to help us repair. You can't repair without hurt. And so it's one of those things where you don't really want to have an opportunity to practice it because it means that there has been a rupture that has happened or harm has occurred. It's really been incredibly beneficial in helping us build a resiliency, because at the end of the day, our programs and services are only as strong as our internal working relationships with each other.
We have an understanding that everybody comes to us with a different history. Each one of the victim coordinators that works for my organization receives trauma-informed care training within the first 160 hours of training that they receive. So it is really, really important for us.
The CARE organization has helped us develop a policy that has an audit tool that helps us look at each of our policies and make sure that it is a trauma-informed care policy, that it respects a person's dignity and rights, and that it helps them feel safe, and that they are collaborative in the care that we provide.
When you bring in trauma-informed care, restorative practices, and then your own DEIB, your own perspective and ideas on what equity looks like for your organization, what you're really doing is continuing to build your staff up. What you're really doing is continuing to invest in the well-being of your staff. And the benefit of that is wow, that's how you foster belonging.
I believe any agency would benefit from the CARE principles and doing the CARE training. It will be transformational.
It can only be better by ingraining the trauma-informed practices into our work. And whether that's for Hasco staff specifically or whether it's for clients, oftentimes a client may come in and maybe initially it's there's nothing we can do for this person, but maybe by taking some additional steps towards listening to them through compassion, empathy, understanding, maybe you find a solution.
If other agencies were to initiate CARE principles, I think it would really support their staff in the same ways that we've been seeing it. It would really encourage the awareness of secondary trauma, awareness of burnout and how high a level that is, being aware of how many of our staff members within social services have high ACEs numbers, and how that affects and why people choose to be in social services. So it really helps with the context of understanding why people choose this work, and then also how to help people who need us and need our services.
I just have a really strong belief that when staff feel like they're cared for by the organization, they are in turn going to care for the families that they work with in a more meaningful way.
If your organization is trying to decide whether to become a partner in CARE or not, I say this: you will do what you do better if you are a partner.
I would recommend joining, because not only are you building up the community around the county and partnering with other agencies and other organizations to really support the community, but also the way that it supports staff.
Go for it. Jump in with both feet.
If you are on the fence about whether to start with the CARE organization, I would strongly encourage you to get over the fence and really give it a try. It will be transformational. It will be energizing, enthusiastic. It will be supportive. It will be like nothing you have experienced before. It will change your whole perspective in how you interact with the patients that you provide care for and how you interact with each other.